Tuberculosis is one of the 6 killer diseases in the world. Every year, about 10 million people in the world fall ill with tuberculosis. Despite being a preventable and curable disease, about 1.5 million people die from tuberculosis each year, making it the world's top infectious killer disease. In Ghana, about 43 people die daily of tuberculosis. As we mark the World Tuberculosis Day, Ado TV's reporter Na Ajele Saki spoke to an expert.
Tuberculosis is infectious but preventable and curable. We are at the Noguchi Memorial Institute for Medical Research, and we'll be talking to the director, who is in the person of Professor Dorothy Yeboah-Manu. She's going to educate us on what tuberculosis is about and all you have to know about tuberculosis. Good morning, Mom.
Good morning. How are you?
Fine, thank you. Yourself, please.
Okay, I'm good.
Okay, so as we know, 24th March has been slated as the World TB or World Tuberculosis Day. So we'd like to know what tuberculosis is all about.
Okay. So good morning, viewers. Thank you for the opportunity this morning to be with you to talk about a disease that is of importance to me personally because of a personal interest in the disease. Tuberculosis is one of the communicable diseases. It is communicable because it can spread from person to person. And this disease is caused by a germ or bacteria called Mycobacterium tuberculosis. So many years back, we didn't understand what was causing tuberculosis. So many people were dying. In fact, more were dying in Europe and the Americas than Africa. And that led it to it being nicknamed the White Plague, or the disease that affected the men of the sea. And several theories were indicated as the cause of tuberculosis by a German scientist called Robert Koch. Research into the disease, and on 24th of March in 1882 he presented this evidence that TB is caused by a bacteria. And that is why now, to be able to talk about TB, we set aside that day, that's 24th March, when he made the pronouncement of what the cause of TB. We call the World TB Day. So what is TB?
Okay. So a brief history about how Ghana got this tuberculosis.
It's difficult to say how Ghana got tuberculosis. What I would say that tuberculosis has been with mankind. If you read the Bible, go to Numbers, you see that even at that age, TB was there. So TB has been with mankind ever. And TB, the closer disease is leprosy. And again, if you look at the Bible, there's leprosy. And if you read Numbers, it was as if it's a cause of a punishment. So tuberculosis have been with mankind ever since, including Ghana. And that is why we have local names for the disease, because it has been with us and we knew it. Thank you.
Okay, so please let's talk about the types that we have, the types of TB.
Okay. So I think the first thing that I would like to say is that how would I know that I have tuberculosis? Tuberculosis affects mainly the lungs. That is your breathing air space. That is where tuberculosis mainly affects. And that one is called pulmonary tuberculosis. But TB can affect every part of the body. In fact, it can even affect the brain. That's what we call the TB meningitis. It can affect every part. And when it affects outside the pulmonary, that's the breathing air space, we call it extrapulmonary TB. So, because most of the people, the TB, and that's the first site anyway of infection. To know that you have TB, in some people there are several symptoms. That it starts, you feel like general malaise, as if you've got malaria, or then you can cough. Most people cough. When you have TB, you cough. That heavy cough, and we say in medical science, productive cough. It means that when you cough, you bring a phlegm, fake phlegm from your body. And it's not every cause. I'll come to that. When you have TB also, you can lose weight. So some people who have TB, they lose weight. When you have TB, you feel tired because it is your L space that is affecting. You see that you are always tired. Things that you could do at first, now you can't do. There are also people, there's also you feel fever. And then what we call night sweats. I know it is hot now, but that kind of profuse sweat, even in air condition, you see that you sweat, your bed is so wet. Not the heat sweating, but the profuse sweating, which we call night sweat. And sometimes when you cough, sometimes you bring out a blood from the sputum. Yeah. So those who have TB, say you feel tired, general malaise, you have fever, you can lose weight, and then you have night sweat, and you can have chest pain as well. Yeah, so if you're tired or what, can be a cause of TB. And please let us not stigmatize anyone who cough, because there are so many things that can produce cough. So it's not every cough that you should think. But once you are coughing, it will not cost you anything. It can be asthmatic, it can be allergy, it can be even when you are by fire, the smoke can cause you to cough. When you are cooking, those coughs are different, even cold. But the thing is that if you have cough and 1 day, 2 days, 3 days, 4 days, seek help. Because when you go to hospital, the diagnosis for TB is free and it's PCR based. So it's very sensitive. So when you're coughing, just go to hospital, it's free. Okay. I spoke about if you are coughing and you have any of the symptoms that I spoke about, whether it is you or your child or your friend, encourage a person to seek help early, because that is very, very important. When we seek help early, we'll prevent other people to get it. So that is very, very crucial. If you are coughing or you feel any of the symptoms, seek help early, because that is one way that we can make TB preventable, because then you reduce spreading the disease. So when you have TB, how do you spread it? You spread it because you have it in your lungs. When you are coughing, you are bringing the TB bacteria or germ out. As I'm talking, if I have TB, I'm spreading. You are singing in a choir or you are singing at church, jumping. If you have TB, you can spread. When you sneeze, you can spread. So these are means of spreading TB. If you have TB, you go to the hospital. Now, Ghana has done very well. We have the modern technology for diagnosing TB, which we use the Gene Expert, which is a PCR based. Now, COVID, everybody heard about PCR. It is very sensitive and it is very good, because once they are detected, they are also looking at drug resistance to the most effective medication, that is rifampicin. And that is very crucial, because once we do that, this will then help the doctor who is going to treat you direct what form of medication to give to you. So now you can ask about the medication.
So let's go to the medication.
Yeah.
So I was talking about the drug resistance.
Yeah. Okay. So when someone has TB, we have drug-sensitive TB. It means that the bacteria or the germ that is causing TB in you can be killed by all the available medication. And so that's a drug-sensitive TB, and that is the one that makes life easier for the clinician and for you as well. And that's why we want you to take your medication seriously. If you have TB, we use a combination of medication to treat you. We have 2 stages. The first stage is called the intensive phase. The objective or the main aim is to quickly kill as much as possible the bacteria that is causing the TB in you. This is important because it will make you well quickly. It will also reduce your ability to spread, because when you are non-infectious, then the community is happy because you will not be giving the TB to anyone. And so the first 2 months, which is the intensive phase, you are giving them 4 medication with a combination therapy, and you have to take your medication every day. Please take the medication, don't miss it. The nurses who will give it to you will explain to you how they are going to support you, how they will supervise you to take the medication. Please listen to the advice. After the 2 months, you will come back to the hospital. The doctor will ask you to produce your sputum again or bring out your phlegm. And I try because it is very important that you come for this checkup. They will take you to the lab. They will test your sputum again and make sure that the objective that we set out, we've achieved it. Now the bacterial levels has come out so low that sometimes even we are not able to detect it in the lab. It doesn't mean that the bacteria is all removed. And this stage is very important. Once we find out that, the levels have gone down, we are responding to treatment, then we move to the next stage, which is called the continuous phase. That is for another 4 months. And this one, they'll give you the medication. You come monthly, and then they give to you. Please, you that you are listening to me, if you have a friend, a sister, be the treatment supporter. Support that person to go through the treatment judiciously. Make sure the person take the medication every day as advised by the nurse who give the medication. This time you are feeling well, and so you may think that you are cured. You are not cured. The bacteria is in you, and every month you have to go back and take the medication. After 5 months, they will collect your sputum again. Sometimes it's difficult because you are getting very well, you are well. And then that is when they take it and make sure that, now everything is okay. They'll give you a last 1 month. After the 6 months, come back again for the doctor to declare you cured. Thank you. So that is a drug sensitive. Now, when they check and you are rifampicin resistant at the diagnosis, or maybe after 2 months, the levels are not reducing, they will take your sputum and take it to the lab again, and then they will check for more drugs to see whether you are resistant. It's not you, human being, that you are resistant. It's the bacteria that is resistant. Bacteria no aso ebi obi onya no first no wanu maduro ni ye nti wama bacteria na gem no aso nti maduro na nke de ma first kese no hoto no say de ma wa no honto. That is why we are asking that, and we are pleading with all of you that if you have TB, please take your medication as you've been advised by the nurse or the doctor who is treating you. So when you come at 2 months and your bacterial levels are not going down, or at diagnosis we found out that you are rifampicin resistant, and then at 2 months your medication is not going down, we take it to the lab and they realize that you are resistant. That's the bacteria that is causing the disease is resistant. Then the doctor will now change the medication. Now, after the first line, we have the second line medication. That one too is free of charge. There's a good news. Previously, if you have drug resistance, you'll be treated for about 24 months. Thankfully, to science and research, it came lower. Now, Ghana has joined the countries whereby if you have drug resistance, you are going to take your medication for some people 6 months or at most 9 months. This is a very big improvement within the TB space. And they say what was sensitive, what was resistant to. And Nije Semba also was the first time I was TB. You better panels as I say, you can't be say all oral. If they're doing in Ania, Ubeno Keke. Because GD say what panel be 60 days or 90 days. Now, thankfully, now it's all oral. So, this is a very big improvement in the TB space.
Okay, so please, I want us to talk about patients with TB and then diabetes.
Okay, yeah. Okay. Also comorbidities. Okay. Before I continue, I think whilst you are taking you have TB, you are taking your medication. There's something that you have to also do. Please eat well. Eating well is not trophy. Eating well is not chicken. Eating well is not all the fast and nice foods. Eating well is make sure that you eat a lot of fruits. You eat a lot of vegetables. And our local foods, thankfully, if you are eating ampesi, kontomire, a bit of insasawa, that is eating well. And fried rice and chicken. Eating your ampesi, if you are a chim or a can like me, eating your ampesi with your kontomire at a sodiano and no so. And when they say, "Oh, did ye?" Fufu na we ya, kontomire nkwai, with your kum kama, so young craning so a, udokun and a woodia. Ma, tomatoes na wuchino, and doors on chinam come. Now, would it ye? We ye sebi, in your mamma fish or so. Two safi, dear whole greens, net toss. That is you are eating well. That is eating well. Our local foods are good. Eating those ones with a lot of our greens and our fruits, then you are building your immune system to support the medication to fight the bacteria. Thank you. So, the TB disease, there are some people that they have other diseases that they are fighting with as well as TB. Sometimes there are some people who may have HIV, key groups are people living with HIV, and people living with, and then you get TB as well. When you go, listen to the advice. It doesn't mean that if you have HIV and you have TB, you are sentenced to death. No, there are so many who get cured and are living well. Please listen to the advice of the doctors. Take the medication well. The same thing with people living with diabetics. There are some people who are diabetics also. When you have HIV, when you have diabetes, it can lead to reducing your immune system, and that make you susceptible to some infectious disease. It doesn't mean that when you have them, you cannot be cured. You can be cured. All that you need to do is to take the medications as you've been advised by the clinician. That's all that I'll say.
Okay.
Thank you.
So please, do we have patients with mental health patients that are facing TB? Or do you have the
TB can affect anyone. It can affect me. So anybody. And the other thing that in fact now is becoming interesting and we want to look into it is that because of the stigma associated with TB, and sometimes when people have the stress that they go in, it's sort of they need people to support them so they don't get overly stressed, because TB is really, really stigmatized in our communities. And now, if you don't mind, can you give me a few time to speak about TB stigma? You have malaria because a mosquito bites you. It means that your environment is not optimal. You have cholera. You have typhoid. If you have typhoid, it's also an infectious disease. In simple language, it means that you drank water or eating food contains somebody's, in my language, feces. You see, it's a dirty environment. And we are proud to say, oh, I had malaria, I couldn't come to work, I have typhoid, I have this, but you will never hear someone says, I've had TB. Please, you had TB because you breathe, and a man must breathe to be a living being. You had TB not because you've done anything wrong. You have TB not because you've been cursed. But our system has made TB so stigmatized. And TB is not a death sentence. I know in my language, we call TB Nsamamwa. Ubot obunya ewana no chese wa yosamai. And no interest ubewu. Some time ago, a can be ne drew you. Enti na onya TB na yem hihye and then antisabium, and then a drew India a quay kind, a drew or ho, ah, wobenum. I did just sense a drones cry free on top. Obenya doctor and so ashew. I bema a drone free. If you have TB, you haven't done anything wrong. It is not a curse on your family. It is not because you are going to die and that you have been witchcraft. That's nothing like that. If you have TB, there's medication. Please come out. That is the big burden of Ghana. People have TB. They are ashamed to come out and they stay in the community. People have TB. They are ashamed to come out. And so they go to prayer camps, they go to other means, and that you are rather doing more harm. You are spreading the bacteria. Please, you have TB, go to the nearest hospital available and seek help, and you'll be given the needed help. Let us all work together and reduce stigma attached to TB. The disease is so stigmatized, so it's so stressful for people, and that brings kind of psychological effect. Hey, TB, the name Shishino. But TB can affect anybody, can even affect me. Can have TB affect big men, small men, short women, big women. It can affect everybody. And that's this year the theme is that yes, we can end TB. Yes, I am part you bet me aso TB sama wano. You bet me aso anoa, not just a moon na ye Cambo, new TB, and your bay for being on the back. And ye paquay bonina, ye case, a ye say a day a symbiatoso, a ye TB no one if it's on home, and you have to breathe to be a human being, and that the disease is curable. So join hands with Ghana Health Service. Join hands with Noguchi Memorial Institute for Medical Research. Join hands with all the civil societies. Join hands with World Health Organization and be part of the TB treatment support system to help make the world free of TB. Yes, we can end TB.
Okay. So before then, I wanted to ask if those with HIV and TB, and then diabetes and TB, mental health and TB, if they are treated differently from maybe somebody living without this HIV, but just TB.
The medication is the same. The medication is the same. There are one or two medications that depending, and that one I won't talk about, but the medication is virtually the same. The other thing is that sometimes depending on when someone has HIV and go to hospital, they will look at your CD4 counts, they will do this, and sometimes they may stop the HIV medication for a short time for the TB medication to start working, then they will bring it. So it depends on a lot of examinations that the doctor will do, and that will advise the doctor what to do, but the medication is the same.
Okay, so what can we do to prevent TB since it's with us already? Yeah. But as individuals, what can we do?
What you can do to prevent TB is what we are doing now. Okay. Tell people about tuberculosis, destigmatize TB, encourage someone who has TB to go to hospital and seek help. Because if someone has TB and go to hospital and take the medication, that person becomes non-infectious. Even that person cannot spread the disease again. And that's one key way of preventing TB. One key way is that as soon as a child is born, the first vaccine is BCG, isn't it? And that's why we are preventing childhood TB. So the key message is that seek help. Be part of the TB support system. When someone you know, your sister, it can affect your sister, it can affect your brother. When someone has TB, the person has to seek help. And that will limit the spread of TB in our community. When the one has TB, help the person to take the medication as advised. If that person take the medication as advised, we are preventing what? Drug resistance. Because when it's not drug sensitive, and I say gem no stroya, a drone, na yarsani easy. Emma sense, ye na ye mfa drone sen ye see mfa no, na gem na de astro, or the bacteria become resistant. That treatment is more expensive and more costly And sometimes we may have side effects. I don't want us to talk about side effects now, but it is better you take the medication as advised. And please don't stigmatize someone with TB. Because if we sit in church, we are in churches, we are with them. And so they are diagnosed. You may be sitting by somebody on the pew. So why do you stigmatize now that they've been diagnosed and the one is taking medication? You understand?
Yes.
So we are with them in our society. Until they are diagnosed, they are with us. So let us reduce stigma. Let us reduce stigma associated with TB.
So, you're talking of reducing stigma. With that, if somebody is infected with TB, you're not supposed to share some things with them. Maybe a plate, a spoon, a cup with them. Won't that person feel that I'm being stigmatized?
Who said that to you? Before the one was like, were you not eating with the person?
Before was
Eating
eating with the person, but then later on, then they're like, you can't do this.
I don't
those
want
things.
us to go on air with this. That we have to reduce things that will stigmatize. We have to reduce things that will stigmatize with them. You understand? You see, and then we let you see, even if you are not sharing those things, your words can be encouraging. You understand? The way I think this I think may be something that I want us to, the words that we use with people with TB.
So you can say that.
Yeah, that one I think is very important. The words can be encouraging. The fact that someone has TB, and I've spoken to TB patients severally, and the words that we speak to them, you know, even if you want that, you have to empathize, put yourself in that person's place. How would you feel? So how can I be kind with this person? You see, but then or something like that. How would you feel? Before that, you were with the person, isn't it? Yeah. And then now that the person is even taking medication, and that within 2 weeks, and we've done a study in Noguchi, around 2 weeks, the one is not infectious again because the bacterial load comes down sharply. You understand? And then days before, you were with the person. Why now? So I think that we need to empathize. We need to put ourselves in their space. Our words should be kind. Our words should be encouraging, to make them feel that having tuberculosis is not a death sentence. It's one of the illness. You understand? And there are more, if you want me to say, in quote, dangerous illness than tuberculosis. Because tuberculosis has medication. The key thing that is the stigma is the problem. The key thing is that we don't support them to go through the treatment, and that is the problem. I've met and seen young ones who have had drug resistance, and they are cured and they are okay. So my message this morning is that TB is not a death sentence. TB is treatable. TB is curable. TB is preventable. Let us all join hands to say, yes, we can end TB. But there are a lot that is required from you and I. That we need to increase the education. So I'm happy that today we are doing this. We need to support those who are affected. We need to help them to comply or adhere to the treatment guidelines and the treatment that the way they have been advised by the nurse or the doctor, so that they go through successfully.
Okay. Thank you.
So that's my message. TB. So let's not stigmatize. So today we are reducing TB stigma.
Yeah.
Adoa TB.
Yeah. So today we are resisting TB stigma.
Yeah.
Yes, we can end TB. With you and me, we can end TB without we not stigmatizing those with TB. Let's all come together and fight against tuberculosis. Thank you.
Thank you, Regina.
Thank you, Auntie Dorothy.